Chapters 37 and 38, we're looking at alterations in the function of the gallbladder, the pancreas, and then liver disease. So we're actually going to start with the liver. So we'll talk about liver failure, and then we'll talk about cholecystitis and pancreatitis. So the liver has several functions. One is it is a digestive organ, meaning it's involved in the GI tract and the digestive process. It is an accessory organ for the digestive system. For example, the liver makes our bile. So we talked about bile previously when we talked about bilirubin and how our liver will take unconjugated bilirubin and conjugate it and use that to make bile. Well, bile is stored in our gallbladder and it's released into the small intestine for fat digestion. The liver also processes and stores fats, carbohydrates, and proteins, which we know is related to the GI tract. And it also processes and stores vitamins and minerals that we have brought into our body. So it has a role in the digestive process. It's also an endocrine organ, so it can influence hormones, meaning it regulates carbohydrates, fats, and protein metabolism. And we know hormones are made up of protein. So most abundant hormone is our protein hormone. We have amine hormones, and we have steroid hormones. Also, hormones may need some of these substrates to be able to circulate in our body as a binding protein. And it can metabolize glucocorticoids, mineralocorticoids, and sex hormones. So it really plays a role in endocrine function by metabolizing and regulating these different biomolecules. The liver also plays a role in blood. It has a hematologic function. So this is where we can actually store some blood temporarily. We know it's involved in the breakdown of red blood cells by removing bilirubin from the bloodstream by conjugating it. It also has hematopoiesis potential in certain disease states if necessary. And we synthesize our blood clotting factors here in the liver. And it also has an excretory function. So we excrete bile pigment and cholesterol. Urea synthesis happens here, as well as detoxification of drugs and other foreign substances that is entered into our body. So Ms. B was prescribed an oral medication, and Ms. B drank a bottle of wine with a friend right after taking the prescribed dosage. And she got terribly ill. So why? She says, I drink this kind of wine all the time. So what happens is we know that the liver detoxifies medications, and so dosages take that destruction into account. But she also drank wine while taking the medication, and our liver will also process wine. And so when it's busy dealing with the alcohol that came in, it may not detoxify the medication like it normally should. And so the client may experience an overdose. And that's essentially what has happened to Ms. B. So now that we know what the liver does, and we know that it has a wide range of functions, it makes sense that, why we would see some of these issues when the liver fails. So when we have liver failure, it'll lead to hematologic disorders, so related to blood. So we can see things like anemia, coagulation defects, leukopenia, which is decreased white blood cells. We'll have endocrine issues. So endocrine disorders can include things like fluid retention, hypokalemia, and disorders of sexual function because of the way that the liver normally metabolizes hormones. We can have skin disorders like jaundice, which we know is related to the bilirubin breakdown of red blood cells. And we can also see red palms. A lot of the times we'll see that with liver cirrhosis. And then we have hepatorenal syndrome. So hepatorenal syndrome is when you have low kidney function due to liver failure. And oftentimes it's because of vasoconstriction of blood flow to the kidneys. So decreased renal blood flow, decreasing kidney function. It can lead to then azotemia, which is an increase in nitrogenous containing compounds like urea in the blood because the kidneys won't be able to remove it like normal. And then we have hepatic encephalopathy, which is worsening of brain function due to the inability of the liver to remove waste from the blood. For example, ammonia is not converted to urea, and then we can see things like tremors of the wrist, confusion, coma, and convulsions. So like I said, the liver does a lot, and so when the liver fails, all of its functions will be, or potentially can be compromised. So this is a good summary slide. So we can see that when the liver fails, it's going to fail to synthesize and store glucose like it should. And so we will have hypoglycemic events. So remember, the liver is where we store a lot of our glucose as glycogen, and it won't do that, and it won't help regulate blood glucose like it normally does, and so we'll have decreased blood glucose. It won't be able to synthesize and store proteins like normal. So our liver actually makes albumin, which is a pretty important protein in the body because it really helps with blood osmolarity. And so when you don't make enough albumin, we have hypoalbuminemia, and that's going to lead to edema and ascites because fluid will then leave our blood into the interstitial space. We'll also have decreased production of our coagulating factors, and so that can increase bleeding. The liver will also no longer synthesize and store lipoprotein cholesterol like it should, so we can have decreased cholesterol. And it won't synthesize and store bile like it should, so we'll have impaired fat absorption, leading to fatty stools and a deficiency in fat-soluble vitamins that actually need fat. The liver will also fail to metabolize and excrete amino acids. So we'll have impaired conversion of ammonia to urea, leading to that encephalopathy. We'll have disorders of the metabolism and excretion of steroid hormones. That'll increase them in the blood, so increase aldosterone, which will cause more fluid retention, leading to, again, the edema and ascites. And we'll also have increased androgen and estrogen, leading to issues with our reproductive system, like menstrual irregularities. We'll also have issues with the metabolism and excretion of drugs, and so we'll have drug interactions and toxicities, and then bilirubin, leading to hyperbilirubinemia and jaundice. So other signs and symptoms that we see with liver failure include abdominal pain and tenderness from inflammation, nausea, anorexia from the systemic effects of inflammation. We'll see also fatigue and weight loss, and then again, the peripheral edema and the ascites because of the fluid retention. So let's move on from the liver to the gallbladder. So inflammation of the gallbladder is called cholecystitis. So itis is inflammation. And it's often caused by cholelithiasis, which is gallstones. And gallstones occurs when we have precipitation of bile, because that's what's stored in our gallbladder. And bile is made up of things like cholesterol and bilirubin. And so when we start to alter the composition of bile by, let's say, having too much or too little, then the bile will start to precipitate, and that's how you can get gallstones. So that's one contributing factor to gallstone formation. Another is stasis of bile. So when bile is blocked from, flowing out of the gallbladder and it's just sitting there, it can start to precipitate as well and turn into a gallstone. And then inflammation of the gallbladder can obviously cause gallstones as well. Cholecystitis is associated with obesity. It occurs frequently in women, especially those who've had multiple pregnancies or if they're taking oral contraceptives. And that's because it just results in more cholesterol excretion into the bile. And we said how when we change the composition of bile, it can precipitate. So bile, to review, is important in emulsifying fat in the small intestine so that we can then go in there and digest the fat and then get it absorbed into our body. It'll pass to the large intestine, and that's where the bacteria will convert it to urobilinogen, and some of it will be lost in feces, and some of it will be reabsorbed into the blood, actually most of it, and then it'll get returned to the liver to be reused. So again, a good example of how our body recycles. And we can filter out some of it through our kidneys, through urine. So let's talk about the pancreas now. So the pancreas, you can see is kind of right next to the gallbladder, and they actually share a common duct into the small intestine. So if you recall, the pancreas is both an endocrine and exocrine glands. So the endocrine part of the pancreas we talked about earlier when we talked about the islets of Langerhans and insulin and glucagon. Now we're going to focus on the exocrine pancreas. So the exocrine pancreas is going to secrete digestive proteolytic enzymes. So these proteolytic enzymes or digestive juices are going to be secreted into the small intestine to help break down proteins, starches, fats that we are eating. Keep in mind the enzymes are going to be made in the pancreas and excreted in an inactive form. And once it goes into the small intestine, it will then become activated. And this is going to make sure that we don't auto-digest our pancreas because our intestines has protection. It has mucus that kind of helps protect the cell wall from being auto-digested. So again, to go over, we have our endocrine pancreas, which releases hormones, again, insulin and glucagon being the major ones, and then the exocrine pancreas releasing the digestive juices through a duct into the small intestine, specifically the duodenum. So one thing that can happen with our gallbladder is biliary reflux. So remember, our gallbladder stores bile, so our gallbladder will contract, sending the bile down the common bile duct. And if there's a blockage that forms, maybe due to precipitation of our gallbladder or of the bile in our gallbladder, then what happens is the bile, instead of getting secreted into the small intestine, it'll just go up the only other pathway that it has. So it'll go up the pancreatic duct and go into the pancreas. And when bile goes into the pancreas, what it can do is it can start to activate those digestive enzymes. So remember, those digestive enzymes are made in an inactive form, and it's only activated once it goes into the small intestine. But now the bile has activated it. So what does that do? It's going to cause those digestive juices to auto-digest the pancreas. So you're going to basically start to eat up your own pancreas. So obviously that's going to lead to severe pain. And you'll have inflammation that produces large volumes of serous exudate, so that will lead to hypovolemia. We'll have enzymes like amylase and lipase. These are some of the digestive juices, the enzymes, starting to appear in the blood. And you'll also see areas of dead cells undergoing fat necrosis, and that's where calcium will start to then get deposited into them from the blood, leading to hypocalcemia. So let's talk about inflammation of the pancreas. So we can have acute or chronic pancreatitis. So acute pancreatitis is a severe life-threatening disorder, and it's associated with escape of those activated pancreatic enzymes into the pancreas as well as the surrounding tissue, causing damage. So we'll start to see fat necrosis, autodigestion. So you're basically eating up your pancreas. Not a good thing. We can also have chronic pancreatitis, and then we're also going to look at pancreatic cancer. And the signs and symptoms are similar to acute, but oftentimes the digestive problems will occur a little bit slower. So the pancreas is not working the way that it should, which means we're not going to release the digestive juices into the small intestines, and so we'll start to see GI issues. We can also see glucose issues, and that's because when we start to damage our pancreas, we don't limit the damage just to the exocrine part of the pancreas. The endocrine part of the pancreas can also be impacted. And so when we start to damage the islets of Langerhans, obviously insulin secretion can be impacted, and so glucose control problems happen. Signs of biliary obstruction can occur because of underlying bile tract disorders or compression by tumors. Okay, so that's where the pancreatic cancer comes in. And that's it for this chapter. Thank you.